First of all, sorry for being late for the lecture.
You can understand.
Okay, so myself Apurva Joshi, and I'm a clinical psychologist and a director of Happy Minds. Happy Minds. So,
Registered in Thane. Registered body in Thane.
We operate in Thane, Dadar, Mulund and Borivali. So operations right now is in Dadar.
Anand Nadkali related one?
No, that's it. So basically I would like to ask you a question, like as the lecture is on mental illness, so what idea you have about mental illness?
Mostly
I think it's
hereditary.
85% of the mental illness, psychosomatic disorders.
Okay.
Where the mind affects the body.
Right.
It is mostly hereditary. As the age advances, if it's a family history, it is likely to be repeated.
Both your answers are right. So we'll just go through the definition once. Mental health can be conceptualized as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, and can work fruitfully and productively even under maximum stress. So, and can contribute to his or community. So by keeping his mind stable, he is able to cope with stress and can work in the community. It shouldn't affect his personal, social or occupational life. That is in simple words. As you said, like it includes emotional, psychological and social well-being. It affects how we feel, think and act. It also helps determine how we handle stress, relate to others and make choices. Psychological health is important at every stage of life. Okay. So we know all this, like how important is psychological health. It is not just being fit, but even being psychologically fit is very important, because just being healthy does not help us to face stress or any related stressful situation, say trauma or any event. We come across so many situations throughout our life and different which are not that stressful.
Stages of life.
Yeah, in different stages we have different situations. Basically what psychology is. Okay. Factors, as we said, they are biological, maybe in genes, maybe through hereditary or maybe through social environment. So these are some of the factors due to which a person becomes mentally ill or is not able to handle that much of trauma. So these are some of the factors. Being psychologically fit is realizing one's own full potential. If we are weak, if we are not able to handle things, then it is likely that a person may become psychologically unfit, coping with stresses of life, working productively and making meaningful contributions to their communities. These are some of the myths in psychology which we feel, that children are not at all affected due to any mental disorder. It is not me who is when any psychological disorder will affect me, and people with mental health problems are violent and unpredictable. This is not true in all the cases. It is only in 10 to 12% of cases where it is a psychotic illness or schizophrenia or some really severe, when the patients become purely violent and unpredictable. Otherwise, all the disorders can be managed by psychiatrists and psychologists. Now, these are some of the early warning signs to see if a person is psychologically unfit. That is, eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, and feeling numb or like nothing matters. Having unexplained aches and pains, as one of my friends said, psychosomatic disorders, that is unexplained aches and pains, feeling helpless or hopeless, smoking, drinking or using drugs without any reason, feeling unusually confused, forgetful, on edge, angry, upset, worried or sure. These are some of the signs of being psychologically unfit. Having persistent thoughts and memories which you can't get out of head. If you see any schizophrenic or depressed patient or a person having negative thoughts, you can see these thoughts and memories very frequently in them. hearing voices or believing things that are not true. This is most common in schizophrenia. And thinking of harming oneself or others, which we can say is suicide ideation or harming others, destructive behavior. Now, how can we help psychologically unfit patient to recover? First and foremost is health. If we regularly exercise or if we keep our health fit, it will help reduce psychological disorders in the future. Support system. Having a open supporter system at home where we help a person to communicate, to have transparent communication and help the person solve his problems or talk about it openly rather than suppressing it. Community plays a very important part in helping a psychologically unfit patient or client to come out of his illness. That is building relationships and social networks that will provide support to such patients. We have Alcohol Anonymous or Diabetic Anonymous is also one of the some of the community centers where they help such patients come out of their illnesses and engage in meaningful activity. It is always good to have some goal and purpose in life which will help you work towards the goal and will always keep you motivated. Now, how a counselor and a client process goes on. It is first, the counselor helps a patient to identify his goals, helps to prepare a recovery plan, specify what can be done to reach these goals, track any changes in episode or illness during the sessions, and identify triggers or other stressful events. Learn how to manage them and include daily activities as well as long-term goals are some of the process which a counselor does. It is not that just a counselor advises the client, but he helps the client come to a solution himself by giving a perspective of different solutions and a different perspective of the problem. So the client himself comes to a solution and the counselor guides him and acts more like a mentor too. Ways to maintain positive mental health, that is having professional help. It is not just when a illness becomes severe you have to go to a counselor. Even if you feel like talking or just saying out if you are under stress, even that would help. Connecting with others, having social network, talking with friends, relatives and being more social will help to keep positive mental health. Staying positive, having positive thoughts, exercising, having enough sleep and developing coping skills. There are various therapies for developing coping skills. Now, this is a question too. Like, how many of you know like what is a psychiatrist and a psychologist? What does it mean?
The psychiatrists, they give medicines, and psychologists, they don't give medicine, just
Consultation.
Talking, interactive relationship.
Psychiatrist should be a doctor, and psychologist may not be a doctor.
psychiatrists, they do MBBS plus, and they do MA psychology.
Very true. A psychiatrist has a medical degree and he specializes in psychiatry, graduates in medical science and focuses on diagnosis and treatment of mental problems and illnesses and mostly gives drugs to patients. That is his mode of therapy to patients. While a psychologist specializes in assessment, diagnosis and mental illnesses and his mode of therapy is treatment is psychotherapy. There are different kinds of therapies for different kinds of clients. So depending upon the client himself chooses a therapy with the guidance of a counselor and then the counselor gives the therapy sessions. Now, I'll talk a little about our organization, which is Happy Minds. In Happy Minds, we have a team of clinical psychologists. We also have doctors, child pediatricians on our panel. And it is a growing organization in the field of education, psychology and research. So these are some of the programs which we have devised for the generation. That is Brain Booster program, which is mostly for age group from 3 to 15 years, where we focus on logic development, creativity and linguistic skills. There are 8 modules in this. Next is the personality development workshops, aptitude testing and career guidance, and remedial programs for various disorders. We also have a facilitator program through our NGO. We also have an NGO, and through that we have this program where our main objective is to reduce rates of dropouts, to make formal education an enjoyable experience, and to guide students to make maximum use of the potential. This is a proposal to us given by TMC to us, and we are working on this. The only problem right now is funding, so we are trying to build this and get it to TMC schools and try to give it to maximum students so that they can benefit with this program. So this is our aptitude test program. Then we have career counseling and pre-marital and post-marital counseling for adults. And these are some of the programs for corporate and adults. Conflict management, train the trainer, problem solving and decision making, emotional quotient, enhancing employee engagement, leadership grid, personality development, and workplace wellness. These are some of the events which we have done throughout last year. We had this aptitude test and career guidance for more than 1,000 students in Dadar, Thane and Panvel. Some of the pictures. This was a personality development workshop for a vocational training institute. And one of the director, me, and my colleague Sanjana.
The previous slide is the director that
Key executives. Myself and one more, Meha Sawan. She's not present right now. She's also an director with us.
If we had got some pamphlet, that would have been better. Happy minds.
Do you have some plan to, because this is a preamble, I mean, do you have future plan to take one topic and give lecture over here?
Yeah, surely. We would like to, it's your suggestion. We can openly interact on a, rather than having PowerPoint, we can even have discussions or debates also. So it would be your suggestion.
Can I have one first thing? The slide showed that ADHD.
Yeah.
Now most of